as our delivery has been changed, right? I think I used the statistic that I mentioned last night, where this time last year, 90%, 10% of family medicine docs nationwide reported using telehealth services. And 1 year later, that number is now 90%, right? So this is new territory for a lot of us, just as it is for you. So just to try and provide some guidance on how to maximize your care and make sure that it is still um, the integrity of your healthcare and the services that you get is still preserved. Okay. So in summary, I like to always start with the takeaway points, and then we dive into them. But telehealth and online services can be a powerful tool for managing your health. Okay, online portals often provide access to many of your clinic's resources, and many of the departments that you would otherwise call or walk up to. When having a phone appointment, it's important to have an agenda of items to discuss. And home medical devices like blood pressure cuff, glucometer, thermometer, and pulse oximeter can help ensure that you maintain optimal care even when the doctor isn't there to do those measurements for you. And contact your medical provider, pharmacy, or go on to myturn.ca.gov to schedule an appointment for the vaccine when it's your turn. Okay. So online portals, by this time, most large medical centers and most large laboratory providers have some form of online patient portal. If it's available, these portals can be really useful to manage your medical care. You can request prescriptions, you can message your provider, ask for appointments from your provider, and you can look at your labs, imaging reports, vaccination records, and even your clinic notes. So I'm just going to show DHS's portal here, just as an example. If you go to dhs.lacounty.gov/mywellness, mywellness is the patient portal for all of the DHS sites. This is the web page that you'll go to, and you would essentially click either enroll or log in here. So if anyone's a patient over at MLK or Harbor or Rancho, if you haven't tried My Wellness, it's actually really It's really useful, and it's not too onerous to log on. All you need is an email address and your birthday. Um, you may not even necessarily need an email address if you want to use your medical record number and your birthday, but just two ways to verify your account, and that's all it takes to enroll. Okay. There's also an app as well, and so for those who do have a smartphone, this might also be a good option. Um, and like I said, lots of other medical groups have similar, uh, uh, platforms. So, for example, for Kaiser, it's kp.org, and that takes you to their online patient portal. They also have an app. Um, okay. Um, just to dive a little bit over to pharmacies, I still get a lot of patients who come in just to request medication refill, and I always remind them. I say, hey, my friend, no need to put in, no need to request a refill in person. You could have messaged us, and the nurse would have let me know. I would have put the refill in. But furthermore, many pharmacies will mail your prescriptions to you. Okay, so MLK's pharmacy does it, CVS, Walgreens, Walmart, Kaiser, all of these have mail delivery services to mail your prescriptions to you. And if you and like I was saying last night, the number of times that you can decrease, if you can decrease the number of times you have to come to the clinic grounds, you're protecting yourself from potential exposure while you're on the campus, right? You know, the campus is not as busy as it usually is because of all the online services that we provide, but still, you know, the clinic site, there is, you know, still people who are being investigated for COVID and people who are not. And we want to minimize your risk as much as possible without compromising your care. Okay, so you can, if you know, this is just a list of some of them that provide mail delivery. If you have a different pharmacy, you know, you can always call them to see if they offer delivery services. Um, One caveat though is that most pharmacies will not mail controlled substances. So if you're taking, for example, Norco, um, or a muscle relaxer like baclofen for pain or muscle spasms. They usually do not mail those. Those have to be picked up, and those need a signature or require a signature for distribution. Okay. So again, preparing for the phone appointment, like I mentioned yesterday, is quite similar to preparing for a regular appointment in person. You want to make sure that you have all of your medications close by, and just take note if you have, you know, if you're running low on medications, you know, if you have less than 2 weeks supply, write that name down and make sure to ask for a refill. And if you have any questions or concerns or specific things that you want to talk about, have those written down before the beginning of the appointment, and discuss those, you know, mention those to your provider right at the very beginning, so that way you make sure that you get all of your questions answered. Um, Again, if you're diabetic, you want to check your sugar routinely. If you have high blood pressure, you want to check it once or twice a day, and make a record of these, because keeping record will help make sure that your provider is able to make smart decisions. Okay. Um, yeah, so some special circumstances, like I mentioned with diabetes, maintaining a sugar log, and also, you know, keeping track of how much insulin you're taking, um, is really, you know, that alone is enough for me, for example, to control someone's diabetes and manage their insulin over the phone. There's some patients that even before the pandemic, you know, they would just maintain a record of their sugar readings. They would check it, you know, in the morning. They would check it after lunch and at bedtime. And then, you know, every 2 to 4 weeks, I would call them. They tell me the numbers, and then I would adjust their insulin. And you know, we would go months before seeing each other in person, because you know, they're able to give me an accurate record of how their sugar level has been. Um, as far as for hypertension, again, if you do have access to a blood pressure machine at home, checking it daily and recording the measurements. You know, the goal for most adults, normal blood pressure is 120/80, right? The goal for most adults with hypertension is to at least keep it below 140/90. Obviously, lower is better. Um, so if you can still achieve that goal of 120/80, you know, that's the optimal option. Um, and checking your blood pressure daily will help make sure that we get you as close to optimal goal as possible. In the case of COVID-19, if you're positive, um, this is a unique situation, in which case getting a home pulse oximeter, and I don't know if you guys ever seen those. It's one of those, and I have one downstairs, but it's like you put it on your finger and it reads your oxygen level. Okay. With COVID-19, there's a specific condition called silent hypoxia, meaning that you have less oxygen in your blood, um, and you may not feel the symptoms of it. right? So you may not necessarily feel short of breath, um, but yet if you check your oxygen level, it's below 92. Say it might be in the mid 80s, low 80s. Okay, so in the case of COVID-19, for example, this isn't standard practice for all clinics, but at our clinic, we provide patients with a pulse oximeter upon diagnosis, so that way they can check at home routinely. If they are also sent home on oxygen, we also give them a pulse oximeter as well to make sure that we know when it is safe to decrease that oxygen level and take them off of it. Okay, so pulse oximeter in the time of COVID is another useful toolkit to add. The thing that I didn't also mention here is the thermometer, right? Because one of the main symptoms of COVID-19 is fever, right? So if you feel sick, if you feel like you have the cold or flu and you feel feverish, being able to check your temperature, and if it is above 100.4, right, that's considered a fever, and you would want to notify your provider at your clinic of that. Okay. And again, and I kind of rushed through myturn.ca.gov yesterday. We can revisit that today. But if you're again, if you're eligible for DHS services, you don't even necessarily have to be a patient, but as long as you're eligible for DHS county services, you can get vaccinated at the DHS site. And regardless of DHS eligibility, if you're in one of the groups where it's your turn to get the shot, you can sign up to take it at myturn.ca.gov. Okay, I'm going to pause right there and see where people want to go with the conversation from here. Do we want to, maybe we can field questions about kind of the logistics of a phone visit, or we can go back to myturn.ca.gov. I mean, I'd be more than willing to help sign someone up to get their vaccine.
Can I ask a few questions, if that's okay, Dr. Rodgers?
Yeah. Mm-hmm.
Um, I wanted to ask for my turn. Is everybody familiar with my turn? What it is? I know even this morning, I guess because my phone is linked to LA, I keep getting text messages almost every week telling me COVID-19 vaccines are available. Sign up. So for a city of LA. So I wanted to ask if you could go through it and maybe just probably explain my turn and then to fill out, has anybody used my turn yet to register for their vaccine? Or are you going more to vaccine sites such as Kedron, or when it's being hosted at pop up at a community site or church?
Uh, my name is Jerry. I'm part of Mount Salem. Good afternoon to all. Last evening, that was the information regarding myturn.ca.gov was very helpful. My son was able to log on and sign up for the COVID testing for the first time.
Oh, great.
He is scheduled to go on Tuesday at Walgreens, located in the city of Hawthorne. It's on the corner of Rosecrans and Prairie. So he's excited about getting his first testing. Now, mind you, he is not a child. He's 52 years old, but he's still my baby. And I was happy to give him the information. And he woke up this morning. Guess what, Mom? I'm going to be tested. Yes, you are. So thank you again for the information. And I'm glad I was able to log on and receive that.
And he always will be your baby. Yeah, right. I'm glad to hear that he got the vaccine, or that he got the appointment.
Yeah.
That alone makes this last night and this weekend worth it. If it means that we get one more person who wants the vaccine to be able to get it, then it's totally worth it.
Okay, I will also like to add he's getting his first test, but it said through the information that they will email his doctor and all the people that are involved. Is there any way he can have them just email him directly and he can give that information to his physician when he goes and see him?
That's a good question. And without going into your son's medical details, based off his age, it sounds like he fulfills eligibility because of some other medical condition.
Yes.
And I think that's why they're trying to confirm through the doctor. So I think best option would be for him on Monday morning to call his doctor and just say, hey, I'm signed up through my turn. They're trying to contact you.
Okay.
And then he can have the doctor push for the vaccine from his end.
Oh, that'd be perfect. Thank you so much. I appreciate it.
And then also, Dr. Rodgers, I know you didn't get to probably specify it, but maybe to talk about it for those, we aren't encouraging it, but for those who still may be vaccine hesitant, where they can still get tested for COVID-19. And I know through MLK outpatient, because we are still encouraging individuals to get tested for COVID still. So if you could spend some time to probably discuss that as well.
Yeah, certainly. So, most testing sites are still open, and there's actually some exciting progress in point of care testing. In that we've now have a 30-minute test that is accurate enough that doesn't need confirmation with the 2-day throat or nasal swab. That one is not as readily available. So the one that you'll find at most testing sites is still the 2-day RNA test. You can get it at MLK Community Hospital. The testing site is still open. My street medicine team is at the Granada on Mondays and Fridays, providing free testing as well. The Granada's on 110th and Broadway. And let me find, if you give me a minute, I'll find the website that will allow you to find all the other local testing sites, right? Because a lot of the pharmacies that are now providing the vaccine were also test sites as well. So many of the same places that were test sites in the past are still available. It's just they're not as busy. Testing has kind of gone down, categorically throughout county. And I see that someone is sharing the free community COVID-19 testing walk up. Yes. This is Dr. Young's testing site that she's doing a pop up on Saturdays on 54th Street at Good Fred's Barbershop. So there are still a lot of places, and your clinic most likely provides testing as well, right? So at MLK, the clinic side as well as the hospital side, we both provide free testing. If you have Kaiser, they provide free testing as well. So yeah, the options are still there.
This one is the Grenada on Broadway. This one.
Yep. Mm-hmm.
Okay.
Yep. Thank you. Mm-hmm.
No worries. And I guess one of the things to remark, because this was one of the concerns, and I know it happened to me because I had to get tested for COVID, and the nasal is, depending on who does your nasal. And I wanted to remark that this is very innovative, but because this is an oral test, this is a mouth swab. So hopefully we can encourage individuals who may not be vaccinated, or even after, if they're still seeing signs or symptoms of COVID, that they're able to visit these sites and to tell them that they're getting an oral mouth swab, you know, because I would tell individuals, go get your COVID-19 test. And they'd be like, I don't want anything up my nose. And so, you know, we had to try to decrease the hesitancy with just going to get tested by COVID. But now this is a quick mouth swab test.
Yep. The oral test, and more studies are showing that the oral test and the nasal test are comparable. Okay, you're not getting shortchanged by getting the oral test over the nasal test. So they're both good tests to know whether you have COVID or not. And just I don't know if anyone's gone over the symptoms of COVID today, but again, I think it's probably worth repeating. So if you have fever, headache, cough, shortness of breath, vomiting or diarrhea, loss of taste or smell. Okay, these are some of the more common symptoms of COVID-19, and you should recommend that that person gets tested.
I think in terms of other questions, perhaps if it helps, if I can ask others, I hope you don't mind, Dr. Rodgers, if I can ask others, had they had any difficulties with trying to sign up online with getting the COVID-19 vaccine, or heard of others that Dr. Rodgers can provide more expertise or perspective to in terms of signing up for a vaccine? No, everyone has had a beautiful experience with getting the vaccine or is still waiting to go for it yet.
That's for the
because
second. The second vaccine. The second.
Okay.
The first one, it was by our Councilman Marquise Dawson.
Okay.
He had a mobile unit at 80 at the park on 88th and Hoover.
Okay.
No problem. I made my appointment the night before and I got my vaccine the next day. But when they put out the message for the second vaccine, it was come between 9 and 12 during this week. And I had to wait an hour or so to get the second vaccine. Because, you know, most people with seniors, they're going to be there at the start of something. So, but anyway, I just thought that having to wait in a long line to get your second vaccine, that could have been cleaned up just a little bit. But then again, if I had gone maybe at 10:30, then it may not have been a line. But other than that, no problem.
Dr. Cobbs, this is Pastor Pat. At Mount Salem, we have our councilman, which is Councilman Price, District 9, to sign up seniors in our community. We did have the same problem. Well, I worked with Dr. Abraham too over at Kedron too. That's where I got my vaccine, and it was a smooth sailing. I didn't have to wait for about 15 minutes for both dosage, if that long, and 15 minutes for sitting there. But with Councilman Price, we did have that same problem that the young lady just mentioned, and we did correct that at our parks. It might have taken us a day or so, but we did correct that there will be 2 separate lines, that the second dosage do not have to wait on, you know, they have a time period to wait, but not a long time period. But we did have that same problem, and they are looking at it at the city too. Also, Dr. Ville and the Department of Health, we are going to have a mobile unit at our church, but there have been a problem with the time. They overbooked and they might have to change our time, but they're meeting today to give me the correction if we still have our same time, but we're going to have it. So I will give that to you, Dr. Cobbs, for you can present it to our group. Yes, and to our churches.
That sounds good. Thank you so much, Pastor. I appreciate it. That's helpful. You know, we're always saying sharing is caring, and we need to get the word out. I know Dr. Rodgers started sharing, so I'm going to turn it back to him.
No, I just wanted to follow up on your question about the testing. So the website, I was blanking on it, but it's covid19.lacounty.gov/testing. And so this is the website where you can find all of the testing sites that are available. And you won't see the pop-up sites that the outreach team and Dr. Young are on here. You won't see those, but you'll see some of the more permanent physical sites. Okay. So that's it. I just wanted to pull it up.
Dr. Cobb, Dr. Rodgers. My name is LaSonia Brown, and I'm from Mount Tabor Missionary Baptist Church. Dr. Tycian Brown is my pastor. And I just wanted to share, a bit of good news. I had both vaccines. I did sign up with my turn. It was seamless for me. They even gave me my second appointment at the time that I made my first appointment. And I received the vaccine at Cal State LA. It was a drive-through, and it was awesome. It was seamless. Got it. Waited my 20 minutes and went on about my way. Had a little soreness in my arm, but everything else was awesome. It was an awesome process.
Oh, yay. I'm excited to hear about that. Great. We want to hear the good stories. Sometimes we hear about the long line waiting hours for a vaccine, but it's always beautiful to hear the good stories. So thank you, Ms. Brown. I think that is a phenomenal story. And, Dr. Rodgers can speak to this throughout based on what I said. But, just like yesterday, we haven't really talked about the side effects that you might get with the vaccine as well. There are side effects. With me, the second one, I didn't have anything, but the first one, I will tell you, I was in bed for the day. My arm felt like it was going to fall off, and I was nauseous. And the vaccine can produce these side effects, and it's normal. Usually they go away after 24 hours, but it's there for a week. My arm was so painful, especially the site of the injection. So, it's important that we tell others when we're encouraging them to get the vaccine, so they don't come to you and tell you, don't get don't come after the vaccine, because what we're seeing, especially for the 2-dose, Pfizer and Moderna, about 30% of the people who get the vaccine, the first dose, do not return for the second dose. So this is important. So I'll turn over to Dr. Rodgers.
Yeah, no, that's a really good, a good point. And there are quite a few interesting side effects with the vaccine. And Dr. Cobb's story is really interesting because it sounds like her first dose was worse than her second dose, which is usually the opposite. Usually most people have more severe symptoms the second dose is compared to the first dose. So I'll share my story and then kind of go into some of the other side effects. But first shot, arm was just a little sore, kind of like how it is after any vaccine, really. And then it was better the next day. And then the second dose, again, 1 day of soreness in the arm, it went away. But then actually about maybe 3 or 4 days later, the arm got sore again. And I actually had a swollen lymph node in my upper breast here, just kind of right under my armpit. And that's one of the more uncommon side effects. It was a little tender. It stayed for, I think, a day or two, and then it went away. And I bring that one up as a reminder, that people are recommending that women who are getting the vaccine, if you're due for the mammogram, you might want to just wait a month before you get your mammogram, because you don't want that that lymph node, which is working. Essentially, that lymph node is a bunch of white blood cells, your immune system mounting up your immune system against the coronavirus, right? It's doing what the vaccine was designed to do. But when you get a mammogram and you look at that lymph node, it's going to look like something concerning on the imaging. So my recommendation is to just, if you're a woman of age who's due for a mammogram, wait a month until after you finished your course to get it, or get your mammogram before the vaccine. So that way there's no, what we call a false positive, something that looks like it's there but really isn't. Okay. More common side effects are just kind of like body aches and chills. Sometimes you might get a low-grade fever. Headache is also a very common one. And then what people are now calling, which I didn't know this until my wife told me, is called COVID arm, is what people are calling it now. Yeah. Where the arm gets very sore, sometimes swollen, and very painful to move. And that's also a pretty common one. Some people have also experienced GI effects, right? So maybe a little bit of nausea, vomiting, diarrhea. You can treat these as you would, as the symptom permits. So if you're having a headache, it's okay to take Tylenol. If you are experiencing GI side effects, it's important to stay hydrated and get rest. And, certainly if you're having body aches and chills, Tylenol or ibuprofen would help out with that